Welcome to class, students. Today, we'll be looking at a very vital topic titled Basic Measures for First Aid. Basic Measures for First Aid. Introduction. Lack of breathing and excessive blood loss are life-threatening emergencies requiring immediate action. A casualty without a clear airway or who isn't breathing may die from oxygen deprivation. Significant blood loss can lead to shock, which can be fatal if not addressed properly properly. Wound contamination. All wounds should be considered contaminated since bacteria are present on skin, clothing, and in the environment. Any penetrating object, bullet, sharpener, knife, bayonet, introduces this organism into the wound. Sharp objects are known to introduce this contaminants into the wound or into the body. Infection develop as bacteria multiply, making it essential to protect wounds from further contamination as soon as possible. When airway management, that is the first priority in terms of the first aid management. When someone is unconscious, their muscle relax completely. When someone is unconscious, their muscles relax completely. If left laying on their back, the tongue falls backward against the throat, blocking air from entering the lungs. Other soft tissue may worsen this obstruction. While the mouth may fall open, this typically blocks rather than opens the airway. Unconscious casualties face additional risk because they cannot swallow or cough out foreign material, potentially causing airway obstruction or allowing materials to enter the lungs. Never give an unconscious person anything by mouth or attempt to induce vomiting. Key point: in an unconscious victim, airway management takes precedence over other injuries, including potential spinal injuries. Always check the airway before assessing breathing. Without a clear passage for air to enter the lungs, the casualty cannot survive. What airway management that is required? Immediate airway management is necessary when a victim is unconscious, has an obstructed airway, needs rescue breathing. Managing airway obstruction: if the airway becomes compromised during resuscitation, promptly roll the victim onto their side to clear the airway. When reassess responsiveness and breathing. Most airway problem result from the tongue and or vomit, which can often be resolved through basic airway management techniques. Common obstructions are the tongue. Muscle tone in the upper airway directly relates to consciousness level. Even when sleeping, minor reduction in muscle tone can cause obstruction sufficient to produce snoring. In an unresponsive person, this obstruction can become complete and fatal. Then we have vomit, another form of obstruction. Food remains in the stomach for hours, so most victims will have stomach content that could regurgitate into the lungs, that is aspiration. The acidity and particle size of stomach content can block and damage the airway. Regurgitation occurs when stomach pressure overcomes the sphincter, usually due to full stomach, obesity, weight on the stomach, or air. Airway assessment and management techniques. How to check an airway: open the mouth and virtually inspect for foreign objects. Perform finger sweep only when an object is visible and can be safely removed with a gloved finger. Implement the held teeth shift chin lift maneuver. Held teeth chin lift technique. Look at the held teeth chin lift and jaw throat maneuver procedure as been seen in slide 6. We now want to look at the held teeth chin lift technique for adults and children. For children within the age of 1 to 8 years, that's what we're considering. Place one hand on the forehead or top of the head. Use your other hand to lift the chin. Tilt the head backward without placing your hand under the neck. Apply gentle pressure, especially if neck injury is suspected. Always wear protective gloves during this procedure. Chin lift technique, typically used together with backward held teeth. Hold the chin up using your thumb and finger to open the mouth and pull the tongue and soft tissue away from the back of the throat. One effective method involves placing your thumb over the chin below the lower lip while supporting the jaw tip with your middle finger and running your index finger along the jawline. Be careful not to compress neck soft tissue with your ring finger. Hold the jaw slightly open and pull forward away from the chest. Finger sweep technique, it is used to clear fluid and debris from the unresponsive casualty mouth. Only perform when you can virtually confirm something to remove. Always use a gloved hand with the casualty positioned on their side in a stable recovery position. Insert your first finger eye into the side of the casualty mouth and use a single sweeping motion towards the opposite side to remove vomit, blood or debris. Special consideration for infants under 1 year old. Infant airways are easily obstructed due to the narrow nasal passages, vocal cords and windpipe. The trachea is soft and flexible, potentially distorted by excessive head tilt. For infants, maintain the head in a natural position. Avoid maximizing head tilt. Support the lower jaw at the chin's point. Keep the mouth open. Apply no pressure to neck soft tissue. If this technique don't create a clear airway, you may tilt the head backward very gently with minimal movement. Breathing assessment. Normal breathing is vital for sustaining life. Unresponsive breathing who are gasping or breathing abnormally require immediate resuscitation. Breathing assessment and techniques. Causes of absent or ineffective breathing. Direct depression of or damage to the brain's breathing control center, upper airway obstruction, paralysis or impairment of breathing muscle or nerves, lung related problems, drowning, suffocation. Signs of ineffective breathing. Signs of ineffective breathing: we have minimal or unusual chest movement, weak or abnormal breath, that is wheezing, occasional gasping, decreased responsiveness, anxiety, unusual skin color, that's pallor, breathing that's either too fast or too slow, unusual breathing positioning. Check for the following. The rescuer should check for the following: should check for look, lis ten, and how to check for breathing. Look for the movement of the upper abdomen or lower chest. Lis ten for air escaping from nose and mouth. Feel for breath on the side of your face and movement of the chest and upper abdomen. Note, this assessment should not take no longer than 10 seconds. Rescue breathing techniques: kneel beside the victim head, maintain open airway, use resuscitation barrier device when available. Take a breath, open your mouth widely and place it over the victim slightly open mouth. While maintaining an open airway, pinch the nostrils sealed with seal them with your cheek. Blow steadily to inflate the victim's. Then, no, the supporting hand may shift, causing loss of air teeth and po ten tial airway obstruction. Pulling upward on the chin helps prevent the problem. For mouth to mouth ventilation, give each breath over about a second with a sufficient volume to visibly raise the chest. If the chest doesn't raise, possible causes include airway obstruction, insufficient air being delivered, inadequate seal around mouth or nose. After inflation, move your mouth from the victims, turn your head towards their chest and lis ten or feel for air being exhaled. Mouth to nose technique. The method may be preferred when the rescuer chooses it. The victim jaws are tightly clenched, resuscitating infants or small children. The technique is similar to mouth, except close the victim's mouth with your supporting and push the lips towards together with your thumb. Use a resuscitation barrier when available. Take a breath and place your widely open mouth over the victim's nose or mouth nose of infant. Blow to inflate the lungs. Remove your mouth and allow for chest for listening and feel for air escape. If chest movement isn't visible, check for obstruction, ineffective seal, or insufficient air delivery. If problem persists with mouth to nose method, switch to mouth to mouth. If nasal blockage prevents adequate inflation, use mouth to mouth resuscitation. Thank you for listening.